Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Food malabsorption, celiac diseases. Yes, the topic is interesting because we all need food. But the irony of it is that when you have even eaten balanced diet, that's not the end. Problem not the finish in my local terms. You find a situation where somebody has eaten a balanced diet, or a baby or a child has eaten something that is so balanced, and yet the baby is wasting, having diarrhea and other complications, anemia inclusive. What could be the problem? It has now been discovered that malabsorption, because when we take in food, the food will go through the stomach and finally in the small intestine it is digested. It is acted upon by the enzyme further, as well as absorbed through the small intestine, microvilli and villi to the liver, where it enters into the bloodstreams proper. This regular process is no problem at all. But the moment the small intestine is integrity is compromised in a way, the way it could be compromised is that part of what we eat, for example, gluten, when you eat wheat bread or other flour like that, and your body reacts, there is this transglutaminase that the body IgA antibody will react against and produce autoimmune antibodies against the microvilli, attacking all the small intestine microvilli, the surface through which these substances get into the blood, into the bloodstream, because it has to get in smaller as amino acid, glucose, and all these smaller, simpler substances. But rather than that happening, then it goes out as diarrhea, waste, all the essential things that would make the body rich will now create serious problem of anemia, wasting and water abuse, diarrhea, and that is what is called celiac disease. The way to really confirm that is based in the laboratory. So that's where the medical laboratory scientists are very effective. There are certain tests they will perform to confirm that yes, you have this celiac disease. And once you abstain from foods that will cause you that kind of problem, the person gets back to normal. Even the discovery of the cause of celiac disease was when during the Second World War, and there was that scarcity of bread, that they discovered that children especially were not having this celiac disease, and that is a disease that has been on since the first century, is now discovered in 1950 to be caused by that. You can imagine the time it took to even discover it. Just like I've always said, stick on, press the like button, subscribe, as I go into the slide section to explain in fuller details what the laboratory can do and the gold standard tests that can be done to really confirm that it is celiac disease and nothing else. The outline: objective, introduction, laboratory diagnosis and recommendation. The objective: to create more awareness about the role of medical laboratory scientists in unraveling the cause of malabsorption, with celiac disease as the main focus. The introduction: full malabsorption is a digestive disorder characterized by the impaired ability to absorb nutrients. These nutrients are in the food we eat, the fats, the proteins, sugar. At least balanced diet must contain both vitamins and minerals through the intestinal wall into the bloodstream. It stems from digestive or absorptive defects, often causing chronic diarrhea, weight loss, and nutritional deficiencies. Common causes include celiac disease, Crohn's disease, pancreatic insufficiency, cystic fibrosis, for example, lactose intolerance, especially in babies,
and so on and so forth. Celiac disease was formally identified as an autoimmune reaction to gluten in the early 50s, when Dutch pediatrician Dr. Willem Dick demonstrated that wheat, and whole flour directly caused the relapse of symptoms in patients. While symptoms were documented as early as the 1st century AD, the specific connection to gluten was solidified post-World War II. Yeah, celiac disease is not limited to people with high level of tissue transglutaminase antibodies, although the presence of these antibodies is a hallmark of the disease. Gluten damages the small intestines in individuals with celiac diseases by triggering an autoimmune response where T cells attack the intestinal lining, as earlier explained in the beginning. This immune reaction causes inflammation that flattens and destroys the villi, the microvilli too, the finger-like projections responsible for nutrient absorption, as shown in this diagram, leading to malabsorption, malnutrition, anemia, iron of vitamin 12 deficiencies, osteoporosis, calcium, vitamin D deficiencies, and muscle wasting. Frequent symptoms include chronic diarrhea, steatorrhea, fatty, foul-smelling loose stool, abdominal bloating, gas cramping, weight loss, and fatigue. Yeah, the laboratory diagnosis. This is in two ways. It's either the serological test or the biopsy. The biopsy has to do with histology, staining, and what have you. The serological test, blood test that checks for antibodies, is usually the first test checking for tissue transglutaminase, immunoglobulin A, IgA, and immunoglobulin G test, endomysial antibody IgA test, diamidated gliadin peptide, that's the protein that is usually attacked, IgA, and IgG test. The serological test that checks for IgA antibodies are more sensitive for celiac disease, so usually what is first done than the test for IgG. But where the IgA, especially in children, is not there, however, in people who have IgA deficiencies, IgG tests may be useful. The gold standard remains the small intestine biopsy, which we show the diagram shown here. You will see the villi destroyed and even the microvilli. Shows characteristics, villus atrophy, and crypt hyperplasia, even if serological tests are negative or low. Finally, the recommendation. Celiac disease, like many malabsorption syndrome, does not need antibiotic treatment or any drug as such, but just abstinence from the food that causes the symptoms like diarrhea or steatorrhea, stool that is pale, bulky, greasy, and floats, indicating fat is not being absorbed. These are preliminary investigations sort of that one can personally do to come to the conclusion that this is likely the problem. It is recommended you do the serological test to rule out celiac disease and stop eating wheat or any food containing gluten responsible for autoimmune response that you may be experiencing. For example, I don't eat jollof rice no matter who cooked it, but I am yet to check what protein my immune system is responding to. For biopsy, however, the biopsy test, you need a pediatrician or even a gastroenterologist specialist, especially where the serological tests is negative. So there are more videos to watch on my channel. Like I've always said, it's over 222 counting, and any topic on health matters that the medical laboratory scientists play a role the importance of the lab is surely emphasized, so that the confirmatory results that gives you that clear understanding that yes, it is what you have, it confirms it. That's where the lab is very important.